So let's start with prepping for the day. Some of my colleagues do this the night before, even the week before, I just found out. I do it in the morning when I first get there. How can we start a day ahead of the game?
So I think what's most important is you do some prep work before walking into the office. When really depends on your practice. You know, the list that I leave when I leave work that night is totally different when I show up the next morning. So for me, it's really hard to do that, whether, you know, drop-offs, add-ons, that sort of thing. So I actually come in earlier, or I have the app on my phone. We use Epic. And so I have that on my phone, and I can still be at home and looking at my patients, but we'll talk a little about that.
Yes.
And whether or not that's good. But it's just important that you're not looking at the chart for the very first time when you're in the room with the patient. It shows.
Definitely.
So you also want to do a few things, right? Ensure that you're looking at the very last note from your most recent encounter with the patient. If they saw another clinician, so not you, a specialist or something, you want to review that note as well, because it shows what's happened most recently. An H&P is also really good to take a peek at because it shows like a holistic account of what's going on with the patient. And that could be like a year ago or so, but it usually has a pretty succinct way of just kind of summarizing what the patient's going through, especially if this is a new patient for you. Looking at prior lab results and, you know, teeing up some new labs that are due, really helpful. If you're going to get, you know, the A1C and the lipid panel, you know, those are really good to have them teed up ahead of time. When patients check in, they can actually go to lab first and get those drawn so that while they're waiting to be roomed, the results are actually running. And sometimes the results are ready by the time your visit starts, which makes for a more productive counseling session, because then you can talk about what needs to be done based on their current results. Be mindful though, because some labs need shared decision making and patients need to be aware, such as hepatitis C, before you order those labs. So you can't do it with every lab, but it works for others. And then while you're going through the chart, you know, reviewing these notes, teeing up labs, update your information. Sometimes the problem list still has problems that have long been resolved.
Yeah.
Your patient doesn't actively have pneumonia 6 months later. So, you know, go ahead and feel free with the resolve button there to update some of those things. And you can also start your note before the patient gets here and just kind of fill in as much information as you possibly can.
So we've prepped our chart, our note is started, and we're in the exam room with the patient. What's next?
Then you set your agenda for the visit with the patient. We've mentioned this before in other talks, but so important to bring it back here again. Sometimes what's written on that chief complaint is not why the patient is actually there. You know, personal problems, or sometimes honestly, they've learned the system and they know that if you say certain things, you'll get an appointment sooner than if you say other things. So important to clarify, you know, it looks like you're here for XYZ. Is there anything else we need to discuss, or is this the issue that you'd like for us to address today? That helps you to kind of frame what the rest of the visit is going to look like. And it prevents what we call the doorknob effect. So you think you've addressed why the patient's here. You're like, oh, one issue or two issues. I'm going to do a deep dive. You use up all of your time. And now you're running 5 minutes late for the next visit when you're leaving. And it's like, oh, but I have another question. So setting this agenda with the patient prevents that from happening to you.
So we often hear about what poor listeners we are as clinicians. Do you ask an open-ended question at the beginning of the visit? Like, what brings you in today? And then just let them talk?
So I don't leave it that open-ended, but we really do have to be better listeners in primary care. You know, I say it all the time, patients diagnose themselves if you let them tell you enough. We have to obviously balance that with, you know, the time constraints that we have and also with relevant information, right? Not everything is pertinent to the case at hand. So I'll ask, you know, I see that you are here today for or back pain. Is this the issue that you'd like for us to address today? So not, what can I help you with? But I'm getting to, we're clearly trying to set an agenda here.
Right.
So add a little bit of specificity.
Okay. And many patients come in with a long list of things that they want to discuss. How can we adjust their expectations when their list is 10 items long and they're in a 15-minute slot?
The list. We have all been mortified by a list or a napkin with the notes on them. So I think the most important thing is to acknowledge that this list exists, all right? You see the patient with it, don't ignore it and focus on, whether it's what's on the chief complaint or the one thing the MA told you that the patient wanted to talk about, because the patient's going to whip that list out on you at some point and you don't want it to catch you by surprise. Acknowledge the list. I see you've brought a list here of your concerns and the issues you'd like for us to address today, and if it's a mile long in a 15-minute slot, I'm very honest with patients and I say, I can't do justice by you and review all of these issues in depth today. So which 2 or 3 of these issues are most important to you? And let's start there. We can get to others if we have time, but we might have to schedule a second visit for follow-up. I often tell clinicians to look at the list for themselves because there are sometimes issues that are very pressing and highly concerning to us as clinicians. One leg is painful and swollen since my last flight, but that doesn't, make it to the patient's top 2 or 3. But that's something that needs to be addressed immediately. So just glance at the list to ensure that, after the patient has chosen their top 2, top 3, you think everything else is okay to wait.